Hi, my name is Dr. Richard and this is Dr. Richard's Insights. Today we're going to talk about constipation. So, what is constipation? Constipation is a disorder where you have difficulty in bowel motion. It can either be too hard or too small, or if you're passing motions less than 3 times a week, or if it's too hard to get out. What causes constipation? The constipation can be due to poor diet or due to some medications that you may be taking or maybe due to a disease of the digestive system. Many patients complain of constipation or perceive that they have constipation, but what they do have is just an unsatisfactory bowel movement. That is not necessarily constipation. Every bowel movement does not need to be satisfactory, or you don't need to get a sense of happiness about every bowel movement. Okay? When do you need to see a doctor for constipation? There are certain warning symptoms. So, if the constipation is new, that is, if you have not made any changes to your diet or lifestyle and you notice that you have constipation now, it is concerning and you should see your doctor. If it's too painful, if you have other symptoms associated with constipation like passing blood in stool, or fever, or weight loss, or weakness, or if the constipation is lasting more than 3 weeks, or if you have not passed stool for a few days, like 4 days or 5 days, or if you have any relatives with colorectal cancer in the family or inflammatory bowel disease in the family. If you have any of the above, it is best to see your doctor or healthcare provider if you do have constipation. What are the tests done for constipation? When you see your doctor, he will take a history and most likely will examine the rectal or perianal area using a gloved finger and a lubricant. He will check for any lumps or abnormalities in the rectum. Any other tests that need to be done for constipation will be based on an individualistic approach, depending on your age and depending on the symptoms and their severity. These may include a flexible sigmoidoscopy or colonoscopy, in which a long tube with the camera at one end is inserted into the colon or large intestine to visualize its lining and to look for any abnormalities. It may include an X-ray, a CT scan, or an MRI scan, and may include pressure studies called manometry to assess the pressure of the muscles, whether they are functioning normally in the rectum and anal area. What is the treatment for constipation? If you have any of the above symptoms or warning symptoms related to constipation, the further course of management will be decided by your doctor. If you don't, you can start with simple steps, most important being a change in your diet. You need to add high fiber to your diet. This can be done through certain foodstuffs like cereals, vegetables, especially green leafy vegetables, fruits like apples, oranges, bananas, prunes, etc. Also, you can add dietary fiber supplement, but it's important not to start with a high dose as this may cause bloating, gas, and cramps. Next is you need to drink a lot of water. You need to modify your toilet habits. This may include not ignoring nature's call. So your body is giving you certain signals when you need to go to the bathroom. If you ignore these signals, gradually they will become weaker and weaker, which will lead to constipation. You don't need to spend excessive time in the toilet. You don't need to push excessively while on the toilet, and do not take any reading material into the toilet. Also, some doctors, some people recommend that you use a step stool. This creates the position of squatting while sitting. It relaxes the anal muscles for a better bowel movement. Another thing that can be done is the use of laxatives. Now, a lot of laxatives are available over the counter and they act by different means. But if you are constantly using laxatives, or if you depend on the laxative to pass a bowel movement, then there's something wrong and you should see your doctor or healthcare provider. And the last thing is biofeedback. Biofeedback are certain exercises which train you to relax the muscles of your anal region while passing stool, uh, or to receptively relax during defecation. So there are certain specialized exercises which are done with the therapist. They are not done on your own. This is all about this video about constipation. If this video has been of any help to you, please do remember to like, share and subscribe to my channel. Thanks for watching.